escape, just get away from everything, and just just getting that feeling in your chest that you've accomplished something.
Amanda Owen found her passion for running as a teenager. But decades later, the pain stopped her. She's now had 2 knee surgeries and has been diagnosed with arthritis.
I couldn't run. It was so painful. It was excruciating. So I started I was walking with my foot out like this because that was the only way that I could walk because it hurt so much. And I just had trouble walking. Like my knees just hurt so badly. So I don't know, can you cut out arthritis, or what is arthritis exactly?
That's a great question. You can't literally cut out the arthritis, but knee replacements remove the damaged joint surfaces. As for running, evidence shows that running does not cause osteoarthritis or wear out your joints. In fact, exercise is one of the best things you can do. But poor biomechanics or a bad gait can set you up for arthritis down the road.
We spoke with Dr. Cheryl Barnabe, director of the McCaig Institute for Bone and Joint Health at the Cummings School of Medicine. The professor and rheumatologist provided some valuable information on how you can prevent arthritis and thrive with it.
Symptoms of arthritis, regardless of which joint is affected, is typically of pain and sometimes stiffness and sometimes some degree of swelling as well. And so when those symptoms start to occur, the natural reaction might be to stop using the joint. So there's this myth that, and we keep referring to arthritis as a wear and tear type of arthritis on the joint, which is not true. We need to break that myth. It's actually critically important to continue to use that joint, strengthen the muscles around it, and to keep active. Otherwise, you're losing strength in those muscles. You might start to develop more issues with the joint not supporting you as you're moving. It's going to be more painful over time. And so poorly controlled arthritis would look as someone who is really just not able to participate anymore in their activities and are choosing to isolate or choosing to avoid doing things that will aggravate that unrelenting pain that they're experiencing.
What are the risks for older people if we're not managing that arthritis, both physically and mentally?
Yeah, the mental part, the isolation that comes with not being able to do the things you want to do, is extremely difficult on people. So they may stop going out for those walks or even hikes with their colleagues, and so you're losing that social interaction, and then you start to sort of hole up and not want to be a part of things, and that's not good for your mental stimulation either. There's so many benefits to being outside with other people that are really critical. From a physical activity point of view, not moving is bad for other chronic conditions. So your blood pressure might not be as well controlled, your blood sugars might not be as well controlled, and so it sort of unravels other aspects of your disease management.
Well, are there things that could be done earlier in life to prevent severe arthritis from occurring?
Yes, there are. So one of the biggest risks for osteoarthritis is a joint injury. And so we're actually other members of our research institute are very, very focused on how we prevent, for example, knee injuries in young female athletes. So if they are playing sports that are at high risk for ACL rupture, such as basketball, soccer, lacrosse, rugby, all of these different sports, if you get an injury to that knee, it does set off a cascade. Now so if we can do something to prevent that injury by neuromuscular training warm-ups, which is a particular warm-up that focuses on strengthening around a joint, working on agility, reacting to short sort of movements, you can significantly reduce the risk for injury in the first place. Then when you do get an injury, it's really, really important to get the right care to help recover from that injury. And in most cases, that will be a really great physiotherapist who can work on retraining, again, the strengthening muscles and ligaments around a joint, help with dealing with some of the symptoms of inflammation and pain that are coming as that injury recovers, and then helping to maintain the joint structure for going ahead for the decades to come to really slow that progression. We also know that there are other risk factors for arthritis. So obesity is felt to be one of them. And a lot of people will think, well, it's obesity because I'm loading a joint and putting more pressure through it. But even in hand osteoarthritis, which is where you get an arthritis of the small joints of your hands, people who have obesity are also at increased risk for hand osteoarthritis. So we think there's something about the tissue that's secreting sort of these inflammatory proteins, and that is triggering immune reactions or joint destruction throughout the body. So being active, keeping weight down in a healthy range are all really, really beneficial as well to preventing the onset of arthritis.
Can you explain the difference between the arthritis that is caused by either an injury or repetitive, I don't even know if I should say that it's repetitive work, but an injury as opposed to inflammatory arthritis?
Oh, for sure. Yeah, yeah, there are definitely, so you're referring to some of the mechanics, so the joints
Mhm.
that we're reusing over and over in a certain way. If we follow like every single human on this planet, if they live long enough, everybody is going to get arthritis in their great toe. And that's because every time we take a step, we are putting, a biomechanical pressure onto that joint. So it is common that joints that are highly used, so like the base of your thumb, for example, those places are typical for osteoarthritis. And so yeah, so even if you haven't done anything to it specifically, but once you get an injury, maybe you're noticing it now because those biomechanics have changed. The tissues are trying to repair, and that has set off a bit of a cascade internally. Now, autoimmune arthritis, so things such as rheumatoid arthritis, psoriatic arthritis, there's over, probably 100 different types we could talk
Mhm.
about. Gout is another form of inflammatory arthritis. All of these different types of arthritis have different underlying causes. So in the case of osteoarthritis, there are changes happening in the cartilage of a joint. There are changes happening in the subchondral bone, which is the bone that's sort of right under the cartilage in each joint. Even changes occurring in the tissues around those joints. Those are really a biomechanical, physiologic type of arthritis. When we're thinking of things like rheumatoid arthritis, that is because your immune system is misinterpreting your own body as foreign. And so it's sending out that response that you would supposed to, save for things like when you see a virus or you see, a bacteria, and your body is supposed to mount a response so that you do not get sick. In autoimmune disease, your body is confused and it will start to see things of you that are interpreted as being foreign. And so it is launching this aggressive attack, and it's causing the synovium, which is the lining of the joint, to start putting out these really toxic proteins that degrade cartilage and degrade bone. So people who've had that form of arthritis and haven't had access to really rapid treatment, haven't had access to really aggressive management of that autoimmune response, they too get osteoarthritis in the joint as sort of a secondary reaction. And so the cartilage loss that has occurred, the bone loss that has occurred, that is where we can't rebuild it. It is just sort of gone, and people are left with the devastating consequences of that. And then a form of arthritis like gout or pseudo gout, which we see very much in people who are in older decades of their lives. That one is formed by different crystals that will precipitate in the joint. So, sort of like when we're kids and we're doing those science experiments where you warm up water and you pour a ton of salt into it or sugar or whatever it was we did, and then you let it cool, and then you add a couple of crystals, and everything precipitates out. That's what's happening in crystal arthritis. And so you've built up levels of uric acid, or maybe you've got a particular calcium crystal. It deposits in a joint and triggers this intense inflammatory reaction. Those episodes tend to be short-lived. They can come on, like maybe some people get them once a year, some people get them almost every day. But what that does is those crystals are actually what's really, really harsh on the structures of the joint. So they can also lead to osteoarthritis as a secondary reaction.
You said well, you said many interesting things there, but one thing
Yeah.
that I found curious was you said we're all going down the road to getting arthritis. Um, with every step we take. Does should that be a concern with exercising more, or is how does exercise play into that if that constant use is causing the arthritis, but we're still encouraging people to get exercise?
Yeah. Yeah. So a couple points on that. So exercise is still important because it helps actually with the recovery of a joint. So if you stop using a joint, it will, as I mentioned, you're losing that muscle structure that helps to support the joint, but you're also losing bone. So you're not loading the bone and helping it repair. So our bones need load actually to turn over and prevent other consequences. And also, as we learn more, there's also an importance of continuously having the cartilage used as well, so that it's also trying to send out its repair mechanisms. Even back a decade ago, we thought, well, cartilage is pretty static, like you're born with a cartilage, and once it's damaged, it doesn't really repair, and you're just kind of hooped. It's just going to continue to degrade. But we've learned much, much more about the fact that there are repair cells that do come in. And so we're really, from a research focus right now, is understanding what are those repair mechanisms and how can we really tap into them to try to restore what has happened to our joints in the past. The other interesting thing about arthritis, and this is what keeps people sort of on our toes in medicine, is that we will see people who have horrible loss of their joint space. They could be bone on bone arthritis. And they may not really have a lot of symptoms. They may not have symptoms that stop them from doing what they want to do. And we also see people who have minimal changes on their x-rays, for example, where there might be a tiny bit of narrowing in one compartment of the joint, and they are completely unable to do their activities like they'd want to because the pain comes on. So there's a disconnect between what we see on an x-ray and what the symptoms are that people are having. And so what we really want to encourage is that, even if the joint is, a grade 3 or a grade 4 loss of radiographic structure, which are the most severe ends of the spectrum, that doesn't mean that you can't do anything. It doesn't mean that you're automatically getting a joint replacement. Even in people who have that severe degree of arthritis in their knees, for example, participating in a physiotherapy program actually reduces the need for surgery over time. So there's a particular program available called GLAD. It is the evidence-based program that's been developed in the Netherlands and then spread out worldwide. And these were all, what they did was they enrolled people who were sort of on that wait list for an orthopedic surgery and instituted a really robust physical training program, physiotherapy, education, peer support. And 70% of people are able to avoid going for surgery because their symptoms have alleviated through doing that activity. So very, very strong evidence that moving, even when there are changes, is really important. And it's not that you're on this long continuum of like inevitable outcome. You can definitely do things to help prevent deterioration of your symptoms and your quality of life over time.
That's fascinating. The fact that people were able to recover so much from that. And also, do we know what the reason is for that disconnect?
Um, Probably has to, so there's two sort of pathways for sensing pain in our bodies. And one is where there's a painful tissue and it sends a signal up to our central nervous system, to our brain, and our body interprets a message, and that's interpreted as pain, and gives us that sensation. But there's also a central mechanism where the belief that there is pain present comes from inside our brains. And then there's this feedback loop. So we think that there's some messaging, some signaling in the pain pathways that are different between different people. So I sort of explain it like there are people who can go out and do really, really, painful things, like people who are doing and they feel no pain. They keep on going out and doing it again. And then there are people that I see in my practice where even having, their grandchild give them a hug is a painful experience for them. And it isn't for anyone else. So we all sort of have this internal thermostat of where we sense pain. And that thermostat isn't fixed either. It can definitely change depending on our sleep and our stress and our nutrition levels.
From your experience, can you think of a story that really illustrates the challenges seniors face with arthritis in Alberta?
Yeah, I think one of them is, people in summer will feel confident going out for a walk, even. So something as basic as a walk. And that's because, there's no ice on our pathways. There's no, slipping risk, and there's more light out. There's more people about. So safety is a main issue. Um, and so when we get to winter months or the freeze thaw that we get so commonly here in Calgary, there may be, again, issues about community safety that makes people not want to go out. That will change where we get our activity. So I really try to focus on encouraging people. Like if it is icy, I mean, I don't like to walk when it's icy out either. I don't want to break something, but we can buy cleats, for example. So apparently, in some of the Scandinavian countries, the nursing homes actually supply cleats to everybody, so that ice is not necessarily the barrier that's keeping people inside. But even doing activity in your home, like chair yoga, online, if you can pull up a free video on the internet of a slow paced, not like jumping into trying to run a marathon on day one of your training program, but a slow paced, responsive program that you can keep doing even when you're sort of staying inside. All of those things are helpful. So it's not going out to a gym and, pounding it out, 5 days a week. The small things that you can do to get up out of your chair every hour and take a walk around your living space, doing something while you're sitting, all of those things are going to be beneficial in the long run.
Going back to the exercise component, um, I was speaking to a woman here who was a long distance runner for many, many years, and she developed arthritis. Um, is it possible that just repetitive impact on your knee can cause arthritis, or does it need to be an injury?
There is. So let's say the running biomechanics were slightly off. And then that, if you don't get those biomechanics corrected and changed, you're going to be putting different forces on your joint, perhaps in an area that's not used to having load. And then that can contribute to those early changes in the cartilage, early changes in the subchondral bone that could set off the full cascade where you then develop arthritis in the joint. So there is that possibility. There are some people who are born with biomechanics that put abnormal loading on different parts of the joint as well. So I think for us all to be aware that even in our youth, it's really important that we're moving in a way that is most beneficial for preventing long-term consequences of that.
This is perhaps a follow-up for the exercise expert you were mentioning, but now I'm curious, how would a person know if their biomechanics are correct or not?
Yeah, so people that are kinesiology, athletic therapy, physiotherapy, that's all part of their skill set. So this is where coaching, being involved with trainers and such will help to make sure that we're, it's not just for elite athletes, basically, right? Where they're trying to peak their performance and gain every little competitive edge possible. This is important for everybody, so that we're sure that we're doing things in the right way.
Okay.
Um,
And then, sorry.
no, that's fine.
Okay. And then the exercise component, should we continue running then? And how far should we push ourselves to the point, I mean, it's going to hurt, but we still need to exercise. Should we look for different types of exercise or push past a certain amount of pain if we are feeling that arthritic pain?
Yeah, so I think if you're feeling that much pain, probably getting assessed is really critical at that point. Especially, I mean, there's people who can run into their 70s, and they have addressed injuries over time or continued to do the right training programs to supplement their running so that they can keep doing it. Some people may decide, you know what, this isn't really for me anymore. I want to change to another activity. That's great. Keep moving. Swimming is fantastic for the joints. It gets your cardio up. Plus, you're not, you have resistance while you're moving in the water, which is great for your muscle. And you're not facing the consequences of the loading that you're doing in a high impact sport for like tennis or running, for example. If you have knee osteoarthritis, being on a bike is a fantastic thing, because that inline activity helps to strengthen up your quadriceps, which helps to maintain your knee alignment as well. And then Tai Chi, a lot of people won't think of Tai Chi as a really, activity that gets them, it's not a run, it's not a big cycle, whatever it might be. Tai Chi has incredible benefits for reducing the pain of knee osteoarthritis and improving quality of life. So all ranges of movement are going to be beneficial for your health overall.
I can see doing a whole nother episode just on Tai Chi and arthritis, but I'm just curious about that. Why is it that in Tai Chi, what is it about that movement that helps in arthritis?
I think it's a lot of strength that's having to be demonstrated to hold poses and move through them slowly. So I think that that's probably the benefit of it. But I would have to look more into it too.
Yeah, no, that's a
Yeah, that's
yeah.
my cursory understanding.
Yeah, so you don't necessarily need to have that impact. I mean, like you're saying, yoga or chair yoga, even gentle exercises can help with it, and we should have understanding. Is that a balance of those types of exercises? If you were to advise someone on the kind of divide between what exercises they should be doing, what would you suggest someone who's just starting off?
Um, so what is interesting to you is probably the best predictor, because if you're doing something you enjoy, you're going to want to do more of it, which is great. Um, so yeah, so I know there's a big pickleball movement that people love. Going for a walk is fantastic. People who do resistance training, um, people who do high intensity resistance training as well. That's really great for preserving your bone density so that you're at reduced risk for osteoporosis as well. It helps with menopausal symptoms if that's the stage of life that you're in. There's like really anything that interests you that gets you out with a group of people that you enjoy being with. Those are things that are going to pay off for your health in the long run.
As for Amanda, she's not letting arthritis stop her from daily exercise.
Because I would walk 2.5 hours. I'd go for a long walk up 14th Street and Sifton Boulevard and down through Stanley Park and River Park and walk to Mission and then back up to 14th Street.